Lifebulb is a patient empowerment platform, and we bridge patient communities with industry, really with the goal to improve the quality of life of those living with chronic disease. So in the area of inflammatory bowel disease, Crohn's and colitis, we are working together with a company called Arena Pharmaceuticals, and they're co-hosting this event today with us. And Arena is a small biotech company with a presence in the US and globally with their products. And they're committed to the space of inflammatory bowel disease. We share really our mission in bringing better ideas and products to patients. And from a Lifebulb perspective, we really do that by connecting very closely with individuals who are living with the disease and those who are supporting individuals with the disease, so-called care partners. So what we do is we listen to the unmet patient needs and even some of the ideas and concepts that patients and care partners can come up with. And then we bridge that gap from the patients to industry, and we try to actually help by bringing those products and ideas to the marketplace. So today, we are fortunate enough to have two very interesting individuals on the Fireside Chat, Grady and Sneha. And both of you living with IBD in various different stages of the journey. And I am going to be stepping back and really allowing for a conversation to be happening between the two of you. So I'd like first to welcome you, of course, and thanking you for doing this. And maybe starting by just giving a brief introduction of yourselves, and then we can get on with the conversation, which is going to be really focused on what it's like to live with a chronic disease such as IBD during this pandemic that we're all going through, and what are the specific issues that you may be facing, and how you are, importantly, how you're handling it so that you can help others who are listening in today. And by the way, this conversation, although it is live, is also recorded so that individuals who are missing it and you who are listening to it can let your friends know that they can take part of it, at least as a recorded session going forward. So maybe Sneha, you will kick it off. So welcome.
Yeah, thank you so much. I'm so excited to be here with Grady and Karin. So I'll give a little bit of an introduction about myself. My name is Sneha, and I am a recent graduate of Indiana University. I graduated in May of 2020, so just a couple months ago. And I was diagnosed with ulcerative colitis when I was 6 years old. And my disease became really pretty severe when I was in middle school. So from middle school to the middle of high school, for a few years, I was in a period of isolation due to the severity of my condition, and also due to the stigma often in my culture with getting surgery. And so we delayed surgery for quite a long time. And so I got my surgery during my freshman year of high school. So I have a J pouch now, which is basically when the small intestine is built into the shape of a J. And so I had the full colectomy surgery done. Now I am living with a disease that's not fully studied super well. It's called chronic antibiotic refractory pouchitis. So some people think it's Crohn's, some people think it's pouchitis. So it's kind of a gray area that I'm in right now. But as a result of my experiences growing up with colitis and not realizing that there was no real support system for adolescents and young adults with chronic diseases, I created the Health Advocacy Summit, which is a nonprofit organization, which I'm currently working at right now, and it's programmed the Crohn's and Colitis Young Adults Network. So all of our programming is geared toward adolescents and young adults with chronic and rare diseases, more so focusing on invisible conditions. And so I'll let Grady take it away from there.
Thank you, Sneha.
Yeah, hi, that was a really great introduction. Thanks for having me here today. I'm really honored to be a part of this with you guys and Sneha. So I'll tell a little bit about myself now. I was diagnosed about 5 years ago when I was a freshman at Louisiana State University. It was literally during the first week of my college career. I started having symptoms that I later discovered were symptoms of ulcerative colitis, But at the time, I really had no experience with chronic conditions or even health from a larger standpoint, anything to do with it really. I was really fortunate to have a relatively normal childhood, and I had never heard of many of the things that I now am very fortunate to be able to participate in and constantly learn about and get to grow with the community and everything. So quickly I discovered that I was not well. And from there, I embarked on a whole journey of trying to figure out what was the best treatment for myself, which was a process of trial and error. I tried numerous different medications throughout the course of my college career and really didn't end up getting appropriately treated until maybe halfway through college. And that was a blessing because I was able to close out my college career with a little bit of better health and everything. Though it was so difficult, it was at least a little bit easier, especially when you're getting into those higher level classes and everything. That's a lot to deal with. And illness by itself is a lot to deal with on top of that. And around that time, after I'd lived with the disease for a year or so, one of the biggest concerns for me became finding others with the disease because, like I said, I had a childhood that was where I was relatively naive to these conditions and where I really didn't know too much about them. I had no family history of them at all. And so I was very, very interested in being able to find others who had some experience in this so that I could learn from them and also find emotional and physical even support from them and just be able to have a shared experience, because that was something that was really lacking in my personal experience, was being able to have others to talk about these things with. Now I get to talk about them a lot, but at the time that was something that I had no experience doing. And I really, as a result, didn't have all the knowledge I could possibly have because I wasn't learning from other people, which is something that I'm really fortunate to have. And the way that I really did that was by getting involved with a number of different organizations. I was on the college leadership board for the Crohn's and Colitis Foundation for a few years. And then I joined the Crohn's and Colitis Young Adults Network with Sneha this past year, which has been an amazing experience and is another reason why I'm very honored to be here talking about these issues with her today. So it's been great. It's been a long journey, but I've met so many people that have changed my life and I've learned so much, and it's really changed the trajectory of my life, and I found a lot of value from that. So I'm very thankful to be here.
You're so incredible, both of you. And I have to say, I really admire how you have handled your diseases, both of you, and very different. One of you, Sneha, really growing up with the disease, and then Grady getting it at a much later age, but still very young. And both of you have kind of taken it to you and handled it well. I got to say, I myself, I live with type 1 diabetes. And when I was diagnosed as a young person, I didn't handle it as well. I just hid it for a number of years. And that's the worst thing you can do. And, to anyone out there who's listening and, is considering maybe talking about their disease with someone else or connecting, I think I really encourage that, because although you can learn a lot from studying textbooks or now online and speaking to doctors, nurses, and so on, there's nothing better than speaking to someone who's been in your shoes. So thank you so much for your, what you're doing for others right now. And obviously you've been helped by others to be where you are. So just getting back, before we get into COVID, how you, embrace the community. I want to just dig into that a little bit more. Sneha, as a young person, and as you said, culturally, it was maybe difficult for you. Can you talk about your transition from having your family as your primary, care partner, caregiver, or caretaker almost, to being on your own, and how you did that?
Yeah, definitely. I could talk about this for hours, but I will keep it short. So in the US, it's different from other countries in that, in Canada, once you turn 18, you have to go to an adult hospital. There is no, you can spend a few more months in a pediatric hospital. And so when I was transitioned out from my pediatric hospital, which I had been in for more than a decade, I was never really established with an adult physician. And that really caused me to have a lot of challenges in maintaining my disease, because I went to college and here I was searching for an adult doctor kind of by myself. And up till when I went to college, my parents were doing most of everything for me, from calling insurance to scheduling appointments to helping me, do my own refills for medications at the time. And so it was really a hard transition for me to go to college, because all of a sudden I was doing all that by myself. I was calling insurance for the first time, and I was taking care of these small things I didn't even think were a part of my care for the first time in college. And so I think, that's the transition and transfer of care field is growing so much, because, years ago, maybe 40, 50 years ago, we weren't supposed to survive into adulthood. And so a lot of these systems have not been created for us to really survive and thrive into adulthood. And so I think in terms of, disease maintenance, it's fallen quite a bit on me relative to when I was under my parents' care. And it's also different because, for example, Grady was diagnosed in college. And so he might have been expected to take care of more things by himself because he was older. Whereas, for example, my parents were doing everything since I was 6 years old. You would never expect a 6-year-old to call a doctor, get appointments, and that sort of stuff done. So in a lot of ways, those of us who are diagnosed a little bit younger might not be as prepared to enter adulthood with our chronic illness.
Even though I think, Grady, you have a story there, I think, to tell, right? Because it was difficult for you when you were diagnosed and you actually needed your parents, right?
Yeah, so I think it's interesting that you bring that up because, as you've clearly mentioned now, we definitely have a different diagnosis journey and experience of living with these diseases. And so I think that's one of the most interesting things for me, is always to be able to hear from others and what they've gone through, because it's just eye-opening every single time to see all the differences in how people experience it, these diseases. And it's true that I was diagnosed in college and everything, and that is a period of independence for young adults. It's the beginning of your education from a professional sense and adulthood in a professional sense. But I think that because as a child, my experience with going to the doctor was really limited to things like having the flu or an infection or maybe the occasional emergency, that those experiences were really guided by my parents, because when I fell and had to get stitches in my knee, I was like 12 and I didn't have the self-awareness to really know how to talk to a doctor. And at that age, it's not really your responsibility either. And as I grew up, I was still in the pediatric system where parents play a significant role in that. I mean, they're the ones paying for it. They're the ones usually scheduling it, and they're accompanying you to all these different appointments and things. And so when I went to college, the timing was actually quite inconvenient for me, because it was like I had immediately gotten to college, where you're supposed to assume independence in all of these adult things, whether it be feeding yourself all the way to independence. But at the same time, I had this exceptional thing happen to me that doesn't happen to everyone. A minority of people live with a chronic illness. It's a huge minority, but it's still a minority of people that live with these conditions. And I was just one of those few people who had to deal with that at the same time that I was having to adjust to college. And so a result of that was I was coming from a background where I did not deal frequently with doctors in the medical system. And I was thrown into a situation where I had to deal with them regularly. And so I remember the first time I went to see a doctor was actually the student health center, which actually probably, had I known more about the condition, I would have known that was not the right place for me to go. But because I was inexperienced with dealing with the chronic illness, and it was the emergence of my symptoms when I first really had to start dealing with doctors, that was a challenge. And then once I actually did find the appropriate doctor and everything, then it was still like, I'm dealing with a lot of different things that are distracting. And by distracting, I mean, I'm having to manage my education. I'm having to establish routines for myself while also having to learn how to navigate the medical system on my own, after my parents had, for the majority of my life at least, really been there to guide me. And even on a more practical level, just being able to know how to take care of yourself and set boundaries for yourself, that's something that I think that
So
a
let's
lot.
get into that a little bit, because that's interesting. Because I understand the administrative portion of it, which is the insurance, getting your appointments, filling your medication. That's a job in itself. You know, many chronic disease patients say they need a full-time position to manage their condition, just from a practical perspective. But the emotional part of it, and both of you have said that the community was important. You know, as a child, you speak to your parents, or maybe your siblings, and you have some support there. But when you're alone in college, and Sneha, you also went off to university, you know, how did you connect with others? And Sneha, in your case, you started an organization similar to myself. I started an organization to try to address some of my own needs. But how did that go, and how big a portion of your life is that, the connection emotionally with others who are similar to yourself?
Yeah. Grady, do you want to go, or do you?
Sure, I can go. So for me, it's a huge deal. So because I think for me, as we've kind of mentioned, I had moved to college shortly after being diagnosed and everything. And so my parents were there, and they've always been incredibly supportive throughout my life. But for the first time, I was living on my own, and I was in an unfamiliar environment. And I hadn't really made any social connections because, again,
Mhm.
I was diagnosed during the first month of college. And so I just didn't know that many people in general. But then on top of that, it's difficult at that stage, and even at any stage, to immediately go up to someone and be like, I have this chronic condition, let's be friends, or let's have a deep
Yep.
connection over that, unless they too have the condition. And so I think for that reason, it's really important that you do connect with a community, or the chronic health community, because you share this experience, and that shared experience really gives you a foundational place to begin a relationship from that just isn't there necessarily, because there's this with other people, because there's a deeper understanding from people who have been through it, or who are living with the same condition, or even conditions that are different. They still kind of have experienced many of the same types of things that you have. And so for me, pretty much as soon as I had gotten some familiarity with my disease and had gotten it under control a bit, I immediately wanted to have that connection to community, because I was in a dorm room and I felt like I was dealing with all these symptoms by myself. And that's an incredibly isolating feeling. And it puts a huge amount of stress on you mentally, or at least for me it did. And it starts to feel very toxic to feel like you're the only one dealing with this, and it makes you feel like your life is ending in a little bit of a way. And so the first thing I did was I looked online, and I was looking for resources, and I found a place where I was redirected to the Crohn's and Colitis Foundation, and I set up a meeting with one of the staff members there. And that was really my entry into the whole community and how many people are actually out there, because for the first time I met someone who did have IBD, and I was seeing them in real life. And that was like mind blowing, to actually be sitting down in front of someone who had the same condition as me. That was crazy to me, because I was going to a university with 30,000 students, and I just didn't know how to even go about trying to find that kind of person. Because again, how do you find that person? It takes a lot of resources and skills to be able to do that. And so after I
You have
had
to
that
be proactive. You have to be very proactive, right? You have to disclose to a large number of people that may not have the disease. Yeah.
Yeah, and you have to be able to also just be willing to take initiative too, which is a very scary thing to do. You have to be able to put yourself out there and present yourself to others as someone who identifies with this condition, or at least accepts part of this condition as part of your identity, which is takes a huge amount of growth and maturity, and also just, I think, strength to be able to do that. And so for me, being able to find someone was really, like I said, life-changing, because they had lived through it. They had more experience than me. And so being able to learn from them really showed me that people are having a normal life with this disease. They're active in their communities. Not only are they active in their communities, they're making a difference in their communities, because this person in particular was working for a charity to help people with Crohn's and colitis. And so that was so inspiring to me, because I was like, this person is using their disease as a way to make the world a better place. And that was something that really was attractive to me. And so from there, it kind of became my mission to just get involved. I went to events, and then I started just trying to connect with people. And after I joined the college leadership board, then people started seeing me online, and they would reach out to me. And every time I connect with someone, I always learn something from them.
So Grady, and I want to hear from Sneha as well, but I just want to ask one more question there. How long did it take you to become a mentor versus a mentee, in the sense of how much of learning, or was it immediately a sharing of experiences where you felt that you were also giving versus taking? Because to me at least, the giving is almost as, I mean, it is actually more rewarding than the taking, but you have to get to a point in your career as a patient to actually feel ready to do that. And I was just wondering how long it took you before you got to that stage.
Yeah, definitely. I think that's an amazing question, and it's really interesting to talk about, because everyone reaches that stage at a different point in their journey. It's a very fluid stage to get to, because everyone's journey is different. And for me, I would answer this kind of maybe in a complicated way by saying that I think I'm still learning, even to this day, about my condition, because every time I meet someone, like even Sneha, and having this conversation, I'm learning from her, because she's had a different experience living with these diseases than I have. So I'm constantly, almost every single day, picking up new information about the patient experience and about IBD in general. And so I'm always getting more and more educated in these areas, in my opinion. But I would say that I had lived with ulcerative colitis for maybe close to a year, maybe a little shy of a year, before I really started researching the community side of things. And in that year, that first year to me is always, or at least in my experience, it was very quick, because I went from being on very basic medications to being on some of the higher tier medications. And I went from having no experience being in a gastroenterologist's office to being in one nearly every month.
Yeah.
And having nearly every kind of medical test done to me, ones that I didn't even know existed or could be done to people. So the education, when it's done in that way, is quite immersive, and you learn very, very quickly. And I didn't know everything. After I connected with the community, I think I learned even more. But in that first year, just through experience, I had learned so much to where I had a very solid, basic understanding of what that first year experience was like. And that was enough to really make me be able to feel comfortable with going out and talking to someone else who had the disease, because now I knew all the medications, or at least some of them that were out there. I knew what some of the outcomes could be. I knew what some of the procedures people would have could be as well.
Mm-hmm.
And so after I went to that first event too, then that was even crazier, because this event had like 50 people who were living with this disease, and all of their families as well. And so I thought one person living with the disease besides myself was hard to believe. And then I saw almost a whole community, which now I know it was rather small from being active online and everything, because the online community is massive. But seeing 50 people in person was like, wow, there are a lot of people living with this disease.
Yeah.
And I talked to people there, and they kind of brought me into the whole community. And from there, once I got involved with the organization, with the college leadership board, I was honored to be selected to that. And that experience really kind of trained me to be a mentor, because now I knew all these other young adults who had a wide variety of experiences living with the diseases, from the most severe to the most, I guess, the most mild, and everything in between, and who came from all over the country, and who were living with a number of different backgrounds. And from being around them, even if it was only for a few days, I really saw how they had been mentors to people, and I was able to follow their example until I myself became more confident in my abilities. And just coincidentally, I would say because of that involvement and because of that experience, people started seeing me. And
Yep.
so as a result, people started reaching out to me.
So Sneha, give you the floor. This was wonderful to hear, Grady. You're really articulate, and it's great to understand your progress and how you've developed into who you are now in your disease as well as a person. So Sneha, your take on this.
Yeah, so to answer your first question, that was about kind of connection, patient connection, correct?
Correct.
Okay, yeah. So as I was growing up, I mentioned this a little bit before, but as I was growing up, specifically in high school, I was thinking a lot about what my future would look like with my chronic illness. And I was thinking a lot about, how entering college would look, how accommodations are different from high school to college, because the high school accommodation process for me was a real nightmare, in that there's so much to coordinate between doctors, the disability office in a high school. And so which actually high schools, I take that back, don't usually have disability offices, it's through the nurse's office, but disability offices within the college. And so there was so much that I wasn't sure about, and so much information that I felt like was not in front of me, and was often written very inaccessibly in ways that, I, as someone fresh out of high school, might not be able to understand. And so I, kind of seeing this massive problem, I brought together about 14 young adults in the state of Indiana in October 2017. And I just really wanted to meet other young adults with chronic conditions. And so
and it was to you not important that they would only have IBD. It was chronic conditions in general, right?
In general, yeah. Because, physiologically, we might have the same sort of disease, but really they're the same societal challenges when we're growing up with an invisible condition. Things like how to talk to your peers, how to navigate 504, 504 plan, how to recognize that you are classified as having a disability, and so you can receive accommodations. I think that's a huge theme that we found with our young adult population with chronic and rare diseases, is that we don't often recognize that we are classified as disabled, and thus we don't often request accommodations under the ADA or under specific acts that are designated for people with disabilities. So we brought together about 14 young adults in the state of Indiana with all different chronic and rare diseases, and we discussed topics like navigating the education system. So what does that transition look like from high school to college to internships in the workplace? We discussed vocational rehabilitation, so how to actually ask for accommodations and what your rights are. We discussed mental health because, as you all are probably aware as well, I think emotional well-being is not protected as much as physical health is, especially when we're so consumed with taking care of our physical health. I think a lot of times medical professionals might forget to bring up the mental health component, or to suggest that to us is something to really protect and take care of as much as our physical health challenges. And so it was interesting, at our first event in Indiana, we discussed mental health, and myself included, that was the first time that we ever really felt comfortable talking about, the anxiety, the depression that comes along with having a chronic disease, and having an invisible chronic disease, that too, which, brings an additional layer of stigma often. And so we developed that first event, and then we recognized that this was something that was really a massive challenge all over the US and the world. And so we developed various summits in different states. And so we were supposed to be in 6 states in 2020, but those all got postponed because of the pandemic. But we've adapted quite a bit to build an online community that can connect young adults with chronic and rare disease all around the world, really. And I think it's really, really important because as mentioned before, we've historically focused a lot on kids and adults, but nothing on this in between. And if you look at a lot of, the research studies, there's so many neurobiological changes happening in adolescence and young adulthood. And it's so crazy to me that we have not, the medical system has not recognized that we are our own age group that has unique challenges, that come about with so many different transitions in our own life, but also physiological transitions. And so
it's a true gap. I mean, I have to say, Sneha, you've identified a gap and you're addressing it. And it's true for all diseases that affect you as a child or as a young person, and then they stay with you because they're chronic.
Exactly, exactly. Yeah, and so the power of community, I think, as Grady has highlighted really well already, is so important. And I think just the in-person connections are better than any resource that we could ever create, because learning off people's experiences is so much more powerful.
Can you bring, I mean, both of you, could you bring a tangible example of what you learned from another person in an interaction, or what you sought out? Because I have one. I know a really clear example, and it has to do with my transplant experience, because I have 2 transplants. When I was waiting for my kidney, I really wanted to talk to someone who'd had a kidney transplant, who was relatively young, and that they could share how did they feel afterwards, and how did they continue to work afterwards, really their life experience beyond the medical. I could learn everything about the medical from the doctors or the nurses, but I just wanted to understand what it was like living with an organ that wasn't, yours originally. And I really searched for that person to connect with who was similar to myself for that question. And I got it. I got great answers because I was able to connect to one person who was similar to me. But I'd be interested in if you have any specific tangible examples for what you were searching for, and if you have a good answer to it.
Yeah, so I can start. I would say that one of the tangible examples I can give, because I have a few, but one of the tangible examples I can give comes from early on in my treatment journey. And maybe towards the middle of the period that I was talking about earlier, where I was still kind of trying to figure out what would work for me, I did make attempts to connect with people, but it was less on my part, and it was more just things that were presented to me through my family. Like my parents would be like, we know this person with a chronic illness, and I was interested in that. And they were my first real mentor, and they really helped teach me the fundamentals. And by that, I mean, I was interested in a similar way about learning more about the treatments that were available to me.
Mm-hmm.
Because I think one thing that you find out is that it's nice to have a medical professional explain the treatments to you, but there's also some value to be found in hearing from the patient experience about treatments.
Yeah.
And so when I connected with this person, I was able to talk to them about their experience. Of course, I still did my own research.
So it was essentially the progression of disease, or across therapeutic, therapy regimens, really.
Really,
that you were interested, in the offerings, the therapeutic offerings. That's interesting. Yeah.
And then
what about you, Sneha?
Yeah, I think for me it was, since I lived with this since I was 6 years old, I think I wasn't really looking for people's stories to go off of, particularly with the disease, because I felt like I had a good handle sort of on how to manage like flare-ups by that point, because it just became kind of second nature, although every flare-up is different, every situation, there's highs and lows, and you have to learn how to navigate those. But I think for me, it was more so what, my career would look like, and what I would, how I would navigate simple systems, like how I would go to college and talk about different issues such as like my dietary restrictions, because everyone in my college was required to purchase a food plan their freshman year. And I was concerned about that because I have a very limited diet. And so I really wanted that connection to be able to know how to navigate certain specific challenges within like the college or the workplace. So I think even when I did my internship, I did an internship at a big pharmaceutical company in New York City this past summer. And I think I could have really benefited from having someone to really guide me through a corporate world with a chronic illness, because it felt like everyone—
You should have reached out to me.
Yeah, I didn't know you at that time. I believe, yeah. And so no, but it was, it's hard when you're picturing yourself,
No, I get it. It was very similar to my question, actually. Very similar.
Yeah.
Interesting. You had more of a systems approach versus Grady was, because he was diagnosed later. So it's interesting, but both of you obviously benefited from having those connections and being able to be proactive in that sense and reaching out. So if we now move on to COVID, which was really part of our plan, what we were going to talk about today, but I think this has been very valuable. it's affected everyone, with or without disease. But for those of us who are living with a chronic disease, of course, it has had specific effects. And I wanted to talk about, because both of you are benefiting from the community, and Sneha, you've already kind of disclosed that your summits may not have happened in the way that you wanted them. But Sneha, if you want to talk about how COVID has affected you both personally, and then of course also your organization, and how you're continuing to help people, and then Grady, if you can talk to the same.
Yeah, so personally, I would say, so I am in Indiana, but I get treatment from New York City. And so I see my medical professionals in New York City. So I used to travel every time I had to get an appointment or something major. And so I had a side effect from a treatment. And so I was supposed to be put on a new treatment in, I think, late March. And I was supposed to have a pouchoscopy, which is basically a colonoscopy for J pouches. And I was supposed to do that in New York City. So that got postponed, of course, because travel was not a great idea at the beginning of the year. And so I had to wait quite a bit to start my new treatment, because before that I would have had to get a pouchoscopy done. And so I think that was a real challenge, because before I was never really restricted with getting my treatments on time, disregarding talking about insurance, because that has always posed some barriers. But I think more than that, it was just really hard to be in such an uncertain time where I didn't know when I would be able to get my next treatment and really start that, because with J pouches, it's really a trial. There's no real set treatment for J pouches right now. So it's, there's that additional barrier as well. And so I think, so that was a challenge, but something that did come out of this was that I was able to utilize telehealth far more widely.
Oh, good. Yeah.
So before, like I said, I would have had to fly all the way to New York City, but now I could just log in 5 or 10 minutes before and get my appointment done that way, which I think was, it was so much better. And I was also able to see more specialists that way as well, because, I didn't have to coordinate all my appointments on one day or 2 days. I could coordinate them, every other week or however I needed to do that. So, I think telehealth right now has been a huge benefit of the pandemic. There are many access issues with telehealth that need to be more addressed, I think, but for me personally, it has been very beneficial. And then for our organization, the Health Advocacy Summit, as mentioned, we were supposed to be in 6 different states in 2020, but we were able to hold an international virtual summit with over 300 young adults with chronic and rare diseases around the world. And we previously would not have been able to reach such a wide international audience, or even audiences in various states. We were able to do that with a 10-hour summit with over 24 speakers. And that, I think, it really showed us how big of a need there is for an organization like Health Advocacy Summit, or for other organizations to focus on the adolescent young adult age group. And so, and I think, there's lots of other challenges that we're seeing with our organization, things that we want to address more. So like high-risk students, what that is like to be a young adult student right now, and navigating college, whether that's in person or virtually. And so we've been hosting weekly virtual meetings since the pandemic has happened. And those have been really powerful in bringing together young adults who are feeling isolated, maybe even more isolated because of their chronic condition, and being classified as high-risk immunocompromised during this time. So I think for us as an organization, it's given us a lot more opportunities to connect with our community than we would have ever really had before.
So you pivoted well.
Yeah, we've been very lucky. Yes.
Good job. Grady, how has COVID affected you personally?
Yeah. So I think Sneha made a lot of really great points. And I think on the community notes that she mentioned, it's very interesting to me. I think it's a very unique time, obviously. And I think it's really bringing to the forefront something that's been going on for a lot of people, even those without illness, for a long time. And that's that loneliness is really quite a difficult emotion to deal with. But I think it's really an epidemic in terms of mental health and how people express themselves and deal with loneliness. And that's something that is very challenging when you have a chronic illness. And now the world is kind of having to deal with being lonely on this very, very global scale because you can't go out and socialize, which are things that people with illness frequently have to skip out on. But I think it's a challenge to feel so lonely all the time and not have an outlet for it. And so that's been one of the challenges of COVID for me. I think that one thing that's helped me, though, is that my experience with entering the community, the chronic health community, really started online because when I was diagnosed, as I mentioned, I was in a dorm and I didn't know how to find people in person. And besides meeting that one person in person, I still didn't really know how to access the larger sphere of activists and community members that exist online. And so the first thing I actually did was join some of the Facebook groups that were relevant to my condition. And from there, that's really how I got involved with meeting people.
Mm-hmm.
So that's something that I think has really stuck with me throughout my whole journey, but has become more important during COVID, because now that I am a mentor and kind of have made that transition to more of a mentor role, I talk to a lot of people who reach out to me because they see something that I've posted or they see me somewhere, and I can just immediately relate to what that feels like. And I know it's even harder right now when you're alone and you're dealing with the stresses of COVID and you're not sure how you're going to get your next medication because things are changed because of COVID, or you're not sure how you can operate how you normally do with your routines, whether that be your diet or how you approach nutrition, because your life and your schedule is completely radically changed right now because you may be working from home. And so in a way, I'm thankful that I had that experience early on of being very much alone with my disease and having to learn how to navigate the internet to find others and how to speak about it online, because I think that's more relevant than ever. And so now I'm quite experienced with being able to navigate online and navigate online communities. And I really try my best when someone reaches out to me to relate to them on a personal level, because being lonely is such a personal, intimate, and vulnerable feeling because you feel like you can't really open up about it. And I think social media, you see all these people who are out there living these lives, and it's hard not to make a comparison to your own condition.
Right.
And so I think reaching out to someone is actually the bravest thing you can do, but sometimes it doesn't feel like that because you see everyone else who are posting about going to the movies if they're not living with a condition, or living their normal lives if they don't have a health condition. And even if they do, sometimes you can see other health advocates who maybe seem like they have everything together and you're wondering why you don't. And that's a challenge. And so I just try to be very real and share my experience of the challenges that I've had living with COVID, because there have been many. It's been difficult to stay on top of my nutrition. It's been difficult to manage stress, but I think that the support I've gained from the community, the things I've learned from people like Sneha and being involved with organizations like CCYAN has really kind of given me the skills and the resources to be able to talk about these things and to be able to cope with them. So I guess to summarize, I would just say that COVID is affecting everyone. And that's just an inherently difficult and tricky thing to do, especially if you have a chronic illness, because now you're contending with two different health crises at once. But while it may feel like you're alone when you're stuck in your apartment or your house, you're really not. And I think it's really important that you connect with others for that reason, because in order to make it through this pandemic, I think the only way that we're going to make that happen is by connecting with others and getting through it together, not alone, essentially.
This is such a fantastic ending. I hate to end this conversation, but my conclusion here is that we have two incredible individuals that we are proud to be calling our Life Bulb ambassadors. We really admire what you do, and I know it's not easy. And it's interesting to me that both of you are, so young, but so articulate. And we have Sneha, who is an expert in the systems and really taking charge through your organization and personally in the big issues, navigating college, navigating access to healthcare, and even transitioning to the workplace, right? And Grady, you're doing this from an individual perspective and really addressing the needs that individuals have outside of those big systems changes, right? And not one of them is more important than the other, because we cannot survive without either one. So, you know, I think final would be to, how do you actually reach you? How do we reach Sneha's organization? How do we reach Grady as someone who's listening in now and saying, you know, I really feel lonely, I feel vulnerable, and I want to talk to Grady, and I want to be connected, and you know, someone else who may be entering the workplace and just needs to be connected through the Health Advocacy Summit. Please, just final words. How do you connect with the two of you? Sneha.
Yeah. So you can reach us at healthadvocacysummit.org. It's spelled like healthadvocacysummit.org. And then for the program through the Health Advocacy Summit, which is a Crohn's and Colitis Young Adults Network, you can reach that at ccynetwork.org. And Grady produces articles every month in video content for the website every month, so you can find some of his work that way.
you took his portion.
No, I'm sure
Grady
has his personal stuff too, which is wonderful. So
yeah, I have a website as well. It's just my name. It's gradystewart.com, and I have some writings up there as well as just some of my work. And then if you're ever interested in having a conversation with me, of course, you can reach out to me through social media or email. My social media on Instagram is just my name. It's Grady WS, and my usernames usually anywhere else is also just my name for things like Facebook, if that's of interest. And my email is gradystewart100@gmail.com. I'm always happy to talk about these things because it's really an opportunity and a privilege to get to meet others with these conditions and get to see what they've experienced. Because like I said, I'm always trying to learn from the individual experiences you mentioned of other people, and about the systems, to talk about systems that they have gone through and the things that they're struggling or succeeding with, because it's beneficial to me, and I hope I can be beneficial to them as well through that shared collaboration.
So on Arena Pharmaceuticals and Lifebulb's behalf, so I really thank you for spending the time with us today. And I thank you to everyone who's listened in. And as I said in the beginning, this is also recorded, so we will be making it available. Any information that you need regarding this fireside chat and other events and you know, opportunities within the chronic disease space, lifebulb.com, and we also have our social channels. So thank you again. Bye-bye now.
Yeah, thank you.